Okay, I'm going to jump right in because we do want to leave time for questions. I've seen a lot of you at previous conferences, and there's usually a lot of questions. So I'm going to fly through very quickly. As I walked up, I asked Nicole, has there been an overview of the policies and the cases? And she said no, so I'll give you the sort of 30-second version of that. I say 30 seconds, it'll take 3 minutes. In 2015, the Ontario College passed a policy that required physicians who have a conscientious objection or a religious objection to a particular drug or procedure to prescribe or perform it in emergency circumstances, and they loosely define emergency, and to provide an effective referral for it in all circumstances. An effective referral, I mean, as a lawyer, it sounded very formal and clinical. I've learned that it had no meaning before that policy used that term. So that's the policy that came out. You have to provide an effective referral, and they defined an effective referral as being a timely referral made to a willing and accessible physician. So you can't refer it to somebody you know is not going to do it. You can't refer it to somebody in Kenora if you're in Ottawa. We started a challenge of that policy, 3 doctors groups, including CPL, and then a few individual physicians. And the challenge was that it violated their charter rights, and specifically it violated their charter rights to freedom of conscience and religion, and their right to equal treatment under the law on the basis of religion. About a year after that came out, that was in March 2015, in January of 2016, the Supreme Court releases their decision in the Carter case. Euthanasia is now coming, so the college goes out and releases a second policy specific to MAID. And in that policy, they adopt this effective referral requirement as well. It's ambiguous as to whether or not you actually have to provide it, but you definitely need to provide an effective referral. So we started a second challenge. Same groups, same doctors, second challenge, and eventually we consolidate the 2. And we went to court here in Ontario, and unfortunately we lost. And it was an interesting loss because the court recognized that these policies violated the freedom of religion. They didn't focus on freedom of conscience, and they dismissed the equality rights argument. So the whole case turned on religious rights and religious freedom. And the court recognized that these policies violate the religious freedom of physicians, and that the violation is more than trivial or insubstantial. And that's a legal term, but it was important because there's a legal test that you need to go through to make a charter claim. And the first is you have to show that there's a violation. It was admitted that there was a violation. You have to show that the violation is serious. And here the college said, well, it's trivial. It's not a big deal. You can just refer. We're not asking you to actually do it. And the court said, no, this is a serious violation. It's more than trivial or insubstantial. But then it went on to say that even though it's more than trivial and insubstantial, it's a serious violation, it's minimally impairing. So the policy minimally impairs your freedom of religion. I have not found another case in Canadian history where those 2 conclusions were arrived at on a freedom of religion claim. They may exist, we haven't found one. And the rationale for why it was minimally impairing was, well, you can just tailor your practice and switch your specialty, right? Really, it's an obstetrician and it's a palliative care doctor, maybe a psychiatrist. And I guess family doctors, you might have a bit of a problem, so just go into dermatology. I mean, seriously, that was the court's rationale. It was really that simple. And there had been no evidence on what it takes to go into dermatology or sports medicine or whatever else it is, right? Lawyers, I don't do real estate law. I don't even know how to do real estate law. But on Monday, if I decide I want to be a real estate lawyer, I'm a real estate lawyer. It's that simple. I know that's not how it works in your world, and clearly these judges didn't know that that's how it works in your world. So we take that up to the Court of Appeal. We appeal that decision, and we appeal it on a number of different grounds. And the Court of Appeal comes out and says, we agree that this is a violation of your freedom of religion. We agree that it's a serious violation. It's more than trivial or insubstantial. However, it's minimally impairing because you can tailor your practice. No solution is perfect, but you do have options available to you. So not a good turnout, not a good decision, and it hasn't gone up. We decided not to appeal it further. But some interesting stuff came out of the Court of Appeal decision. The Court of Appeal concluded that not following the policy, meaning not providing an effective referral when you have a conscientious objection, does not in and of itself constitute professional misconduct. They said all of the policies do is have a normative effect. So what that means is it really creates an expectation of how you're going to deal with it. So if you refuse to provide a referral and there's a complaint filed against you, the fact that you've not provided the referral doesn't sink you automatically, but we're going to look at these policies and we're going to look at that when we determine whether or not you are guilty of professional misconduct. I mean, it sounds ridiculous, because it is. But that's an interesting thing that the court came out with. They said these are not necessarily binding policies. Now, if you ask me, do you need to follow these policies? As a lawyer, I'm going to tell you, yes, you have to follow these policies. And if you don't, you could suffer consequences. But what that means is we're going to actually have a very interesting couple of years ahead of us as doctors start to get disciplined for these refusing to provide referrals. And as I understand it, well, not as I understand it, I know at least one doctor in Ontario is facing a complaint that's being investigated by the college for refusing to provide a referral. So it's coming. And as it comes, we're going to have to really think about how we mount a proper defense. The CMPA is not going to fight for you to refuse to do an abortion or MAID. So that's that case, and that's where it's ended. So what does that mean for us here? Well, in Ontario, it means the policy stands, and you really are liable to some kind of consequence if you don't refer for it. You know, Nicole said we're out of step with the rest of the world. We're out of step with the entire world. At the time we argued the case, things might have changed in the last 2 years, but at the time we argued the case, Ontario was the only jurisdiction in the world where assisted suicide or euthanasia of some form was legal, where they required referral. No other jurisdiction in the world required it. So, I mean, what is it that Ontario can't figure out that the rest of the world can, right? So that's the CMDS CPSO case. We're unique in Canada. If you're outside of Canada, outside of Ontario, you're not in terrible shape. If you're in Quebec, I mean, you're in Quebec, so there might be some problems there. But if you're outside of Ontario or Quebec, you actually have options available to you. Most other provinces either have explicit protection against having to refer, or it's somewhat ambiguous, and you have to, you know, it's worded as such that you have to ensure that you provide adequate information for the patient to find the service they want, which may include a referral, but the overriding theme is you can't abandon your patient. So outside of Ontario, you probably can you probably can find a way to navigate the system without crossing a line you don't want to cross. In Ontario, well, you know, we'll see what happens. The second case Nicole referred to is actually a very interesting case, came out 2 weeks ago. And it has nothing to do with conscientious objectors. It involved a woman who was on life support, and the hospital wanted to remove her from life support, and her family objected, saying it would violate her religious beliefs. They went, they got an injunction. Ultimately, she died of natural causes. Family sued the hospital, sued the doctors, went all the way up to the Court of Appeal. 2 weeks ago, the Court of Appeal releases a decision, and it didn't go well for the family, but the decision is actually really interesting and has all kinds of good stuff from a religious freedom perspective. And some really interesting language in there around physicians' obligations and charter obligations. So for the non-lawyers, and most of you are non-lawyers, you often hear about charter rights, and the charter protects freedom of religion, freedom of expression, all of these things. It's very true. The charter doesn't apply to me, and it doesn't apply to you. It applies to the government and government actors. So if I have an employee that wants some kind of accommodation on religious grounds and I don't do it, it's not a charter violation. I mean, it's a human rights code violation, but it's not a charter violation. If the employer is a government actor, now it is a charter violation. And part of the issue in our case was that we said there's no conflict of charter rights here. It's not the charter rights of the doctors versus the charter rights of the patients. It's only the charter rights of the doctors, because the doctors have no charter obligations toward the patients. And the court actually rejected that. They didn't go as far as to say that doctors were subject to the charter or that doctors were government actors, but they said because it's a publicly funded system, patients do have charter rights. And I mean, that's true, but it's very nuanced, and the court kind of glossed over it. But in this decision from 2 weeks ago, the court comes out very clearly and says doctors are not subject to the charter. Even though they are implementing a program, a healthcare service that is provincially regulated. Now, there can be instances where a doctor is subject to the charter, but generally they're not. So that's a very good decision from our perspective, because it will neutralize, or it ought to neutralize, this argument that we are violating people's charter rights by not wanting to prescribe or perform or refer and so on. So those are the two cases. I mean, not much of an update because it hasn't really changed since last year. Last year we were waiting for the Court of Appeal decision. Now we have the decision. It's basically the same as where it was. But in terms of where you go from here, if you're outside of Ontario, keep doing what you're doing. And if you're in Ontario, I mean, you have an obligation to follow the policy, and if you don't follow the policy, you're subject to discipline and other proceedings. So that's kind of an update as to where we're at. Do anything else, or do we just go to questions?
I think we should go to questions and then
Okay.